Hello, everyone. My name is Zhengis Zhamashev. I'm a host of this podcast. We have a special guest from South Korea, James Kang, International Sales Manager of Xenosys company. Welcome. Welcome, James.
Yes, nice to meet you, Zhengis. Yeah, I'm from Korea. My name is James Kang. I'm in charge of the international sales in all of the world. I'm in carrying. So I travel a lot, and then I introduced our products to our distributors, and then I came to each country for training our distributors, and then I go to the dentist or the hospitals, the OR, for having any troubleshooting or to guide them, or the demonstration or any issues that I can just to figure it out or to help them to make that our sales going on with the good way.
Great, yeah. Perfect.
Yeah.
So I know that Dentoptics has close relations with Cenosis. And is it your first time visiting Kazakhstan?
Yes, I do.
Yeah?
Yes, this is my first time.
How do you enjoy visiting?
The weather is really, I think it's good. And then it has a very nice, lots of mountains like in Korea.
Yeah.
And then, I think it's very nice. Yeah. But the food is also good.
Great. Yeah. Of course, Kazakh people does the best. Hospitality.
I'm a big fan of like a meat. So
yeah. Even better.
Yeah.
So, let's move to, Cenosis company.
Yeah.
I'm curious about, first of all, I would like to say that I bought a couple of months ago, I got my lenses, loupes, dental loupes from Cenosis 7.5. I was the first person who ordered 7.5 magnification.
Wow. Yeah. Congratulations.
Yeah, thank you very much.
Thank you. Yeah.
So I needed more details in my practice. I finished the internship and I really enjoyed and I'm enjoying the using of Xenosys dental loupes.
Yes.
So I'm curious about the history of the company. When it was started, and what is the history?
So I will introduce you a little bit briefly about our company. So it's been from 1998 or 1999. So our CEO, and then he has a team, the two people, engineers, and then we have a professor from Seoul National University of so he is physics. So he got optics technology. So the one guy came to us, and then he wanted us to develop the very lightweight and the very good loupe with our technology. And then previously our CEO and their team was focused on about developing the military products, like binoculars have like a very similar technical mechanism like loupes, the two telescopes, and they combined in one position. So they're just a little bit hesitating, but he was forced, and then so they started to develop with the very lightweight 2.5 hour first sun, the first product. Yeah. So it was very lightweight and very good quality of the optics came out. So we started our business from the technology of the military optic technology to implementing to the medical devices. So that's when the Genesis begins. And then later on, we go on to be developing about LED headlight, very lightweight and a very bright headlight, and then camera system and the other kind of loupes so far. So that's the way our history begins. And now we're having more than 20 years about developing optics and then manufacturing all the things in here, Korea.
Yeah, I was born in 1999, so I can say that Cenosis is like 23 years old, right? It's very interesting. So you said that from military optics, you combined like military optics and the medical, and that's how Cenosis was made.
We are implementing they have an experience about in the military optic. They should follow about the mil-spec from U.S. government. So it's very strictly following about ergonomic design. So it should be very healthy to human eyes. So we are very focusing on about our dentists or surgeons, the eyes health. So the loupes should be very much natural, to be same as like looking at the bare eyes. And then if you wear the loupes, it should be same as natural. So that is the way our kind of like a policy or like a doctrine we follow about making all of our products.
Yeah, I definitely can say that while using the dental loupes, you can even forget about that you are wearing dental loupes and
very
just
happy
working.
to hear about that.
And it's very interesting. So we will continue with Cenosis. But I'm curious also about your career. How did you join Cenosis and when it was?
So actually, I joined the 2010 July for Xenosys. My job was like some overseas sales manager, and we had a very limited distributors in a certain area. And then before I joined, I was working as a AIG, now turned into the AIA, is an insurance company, and previously Prudential Financial. So I was working as some financial and insurance guys. I've been working with like a sales agent, and then I was working as a bank assurance manager. I was working with the bank guys to selling the insurance things. So, and then I just felt like I'm a little bit exhausted, and then I'm just spending too much energy about too much things. So I want to be starting my career as a new things. So combine as our sales career into a new area. So I was looking at some companies, and then they were looking for the guy for the overseas sales, the international sales. Like import, export, and then finding a new guys who want to distribute our products. So I just knocked the door, and then they just welcome me. So that's why I joined then. So having 13 years in a new career, so I'm very satisfied with it.
So I think you saw everything, every new technology that Cenosis created, from new optical technologies.
Right now we have new the Ergo type loupes.
Ergo loupes. Ergo loupes. So when since we started about the overview, can you please overview about the loupes? Can you tell us about the loupes? What kind of loupes we have from Cenosis, and which technologies you use for manufacturing?
Briefly. So what you're seeing is just a kind of the flip-up loupes. Many people have been using about this flip-up type. Just to flip up and down, and then adjust to fit your IPD, so they can share it. But people think about it, so just to share, and then it's sometimes broken, and then have to just adjust all the time. So we just move on to kind of the way of like this TTL, what it calls, through the lens. So when we make a hole and then embed the two telescope with our own technology to making this alignment of the optical axis to be precise as to be one point. That is the working distance of each customers. So this one is totally about the custom-made loupes. So we have from 2.5, 2.8, 3.2, 3.5, and 5x, 7.5 so far now. But for more magnification, there is a need. But if the magnification is more than 7.5 or 8, and you wear it, and if you just breathe it, you can feel it. It's just the image is a little bit moving, so it just disturbs you about doing kind of what you do. So that's the way, following our mil spec. So we are not doing on that to protect the customer's health.
You just stopped on 7.5.
So we can make it more, but it's just for carrying the people's eye health. And then we have this wireless headlight. And then this one is the yellow one is L2S15, our best-selling headlight. It's quite bright. And then some like maxillofacial surgeons or the cardiac surgeon or the implant surgery, they do all kind of this kind of headlights. And then we don't have it here, but we have wireless head LED camera system.
Yeah, I saw on the website.
It's an LED headlight, and the camera system is combined, and it's Wi-Fi connection by our Apple. You can just simply download the application, and they also Android is possible.
Yeah, it's very interesting because I have the wireless LED. It's very useful because you have full batteries and you just you can change after using each of them. And the yellow one, L2S15, yes, you said that's for cardiac and for maxillofacial surgeons.
Yeah, but some surgeons quite likes it because it's very bright headlight, and then the battery runs like for first step. It goes like 23 hours, and the maximum for intensity it goes 5 hours. So it's very useful. They don't need to change the battery every time.
Because they have like long surgery, they don't need to change.
It's just the wired one, so they have to connecting with the Loupes nose pad, or using this kind of the headband. They're using. It's their options, whatever they prefer.
Yeah, it's also soft, so you also cannot feel that you're wearing the headlight. It's very interesting. Let's talk briefly about the Ergo Loupes, when it was started in Cenosis, and what's your plans? I mean, what is the plan of Cenosis in the future for Ergo Loupes? Because it's a new trend in the dental loupes.
So we were, of course, that many previously. I think the Pentax was the godfather. They started from at the first time. The Pentax about this angle type loop. So many of the dentists or some surgeons, they're suffering about their neck pain, about many problems about the back and the neck pain because they don't have the enough angle of the loupes, so they have to bend their neck. And then doing on that more than like a preps or the cardiac surgery more than 5 hours, and the open heart surgery or the prep, you have the experience. It's like it's just going on. If you focus on that, it just goes on 3 hours or 4 hours making on that. So they feel lots of the pains. So the request from the Pentax got the patent. So they want to make it in some people they lay down the bed, they want to see the television without any moving their heads, something like that. So it comes up their ideas. So they making something, the loupes, so their neck straight ahead, and then they go down side. So something comes up like that. And then the other companies coming up, like making this kind of things. But they get a patent, likewise it said. So they have a special technology about to making it a human eyes very much kind of the healthier. So we were just struggling which way we have to follow. The many of other companies having, I don't care about the people's health. It should be in a one circle, and that they have to be make straight, and they will be happy. So some companies making like that. But if you have an experience about seeing Pentax, you'll see a little bit double circle. Because the normal loop will be in a one circle, because that is a technology what you having very used to be. But this kind of the angle loop, a little bit different way, because if you see like this, the line, if you see straight and the line goes up, and then you go, the optical axis should be matching on here. So it's not in a typical way. So it should be having a lot of technologies should be added to making this optical axis. So we followed about the Pentax way. You're seeing a little bit double circle, but that is good for your eyes. And then it should be. Like if you're using this kind of operating microscope, you're using a little bit double circle. And that is the way it should be. If not, it cannot be like that way. So it should be making on that way, and then healthier. We're making the optical axis should be correct to be, and then you can find it like you're seeing on the straight lines of the grid, and you'll see the difference. If you're looking at with ours, you'll see the straight lines. If you compare with the others, you'll see twisted.
Yes.
Yeah, that is the total difference. And then so that is our keep technology to follow. So right now we have 4x and 5.5 and 7.5 for these three kinds of angle loop. And then we having a little bit barrier, but it will come out soon. 2.7.
2.7.
The angle loop will come out.
So it will be produced very soon, right? From Cenosis.
We're working on that. Yeah.
No, 2.7. Yeah, it's very interesting.
Yeah.
So me as a dentist, I can say that when you work, usually, of course, in the past we worked like in 9 hours. From 9 hours, you know, not from the back of the patient, but from the right side of the patient. You, of course, for the purposes of the treatments from the 9 hours when you positioned in from the right hand of a patient, you need to use straight loupes. But usually for prosto, for also for endo and for other procedures, we positioned from the back of the patient, 12 hours. So usually we use, of course, I use straight 7.5 dental loupes, and sometimes I can say that I should also get. Sometimes I have a thought in my mind that I need to buy this Ergo loupes from Cenosis because
there is a certain need, but it's definitely still this. Traditional loupe is needed because when you're working with like a patient, and then so the straight lines, like a periodontist or orthodontist, they can go on with like a straight position. But if you're doing like some implant surgery or the endo, and you have to take care of the upper teeth, then you have to be like this. So you wear the loop, but you're not doing like this. You have to go straight this way, but you can't do that with this kind of angle loop. So it should be not going. It is very good with the one way. If you have a one, and it's a Five Guys tools. You can take care of all things. That will be best. But you know, the life is not going on same as like that. It should be you having a lifeboat and the other things. You need the backup, things like that.
So I think it's better option if you have both of them. For example, straight loupes and also Ergo loupes. So you can choose. For example, if you plan to work some perio or prosto endo, you just you know that. So for example, I will be working from 12 hours from the back of the patient. So I just choose Ergo loupes, and after that, after using, maybe if I have some surgical procedures, right? So I need to use the straight loupes, and then I will use straight loupes. So that's very interesting. So also, I'm planning to buy after using.
Welcome anytime.
Maybe after 1 year or 1.5 years after the great experience with 7.5, maybe I will. I would buy another one, Ergo loupes. So it's so incredible just to use it. And for example, some my colleagues asking me about what is the time of adaptation, right? Just what is that time? But from my experience, I can say that my first patient with this dental loupes, surgical telescopes, I adapted maybe after 2 hours. After 2 hours, I just focused. I just positioned in one position, and just after that I forgot that I'm wearing the dental loupes. So it's I adapted it pretty fast.
But I can simply say that it differs from each people's experience about that. If you're quite new to the loop, we always recommend, I think you better start with a 2.5 or 2.8. If you start from like a 3.5 or 5x, like your professors advise, because in the UK or in the US, in the other, many of the European professors of the dental, they're quite used to be about starting from the higher magnification, and then they feel lots of merit from the starting, and then you can have a better treatment, and then you can have a better view of the full arch or the teeth. So you can have a better technologies can acquired. So that's why they recommend to starting with like a 3.5 or like a 5x. It's better for you. But if you're the first timer, we always recommend starting from 2.8 or 2.5, and then you move on to a higher magnification. The adaptation time will be quite shorter. And like a 2.5, it just takes like with maximum 1 week. And for 5x or 7.5, it also takes time, but 1 week or the 10 days, we're thinking about it. And then it should be matching on your precise measurement, and the prescription should be correct. And then the working distance should be correct. And after that, in a certain adjustment time is finished, and then they can acquire the more experienced, and then they feel more comfortable about our Cenosis loupes. I think so.
Yeah, because you said very correct about the prescription, about the measurements, because the guys from Dentoptics, your partners, when we had the appointment in our dental clinic where I work, just they came to the clinic and they made all measurements like working distance, how I usually sit with a patient, how I work, and they just measured everything. So maybe it took 2 hours, but after 2 hours, of course, we had very precise, just all everything that we need for ordering the dental loupes. So I think that's the key of success of adaptation, right?
The precise measurement is very good because that is the way to minimize your adaptation time, and then it's good for the customers and good for the company. They can save time also.
Yeah, awesome. Let's talk about the glasses. Because I really like the shapes of the glasses and also the material they're made of. So just can you tell us about the materials and about the models of glasses?
So for example, like this, the frames, we using different materials. The front is very lightweight, like aircraft aluminum we're using. And this temple is titanium. And this joint part is from the stainless steel, making a little bit withstanding lots of the on and off taking. So it should be standing like that. And this one is like from kind of the plastic. And then the lenses inside, there are lots of materials. I can tell each of the materials. So very kind of the, universal ones we are using right now. And then the lenses, what we're using, for example, like higher magnification, we use from the Asilo sometimes, from the French ones. And we sometimes use like a Shores or the other ones. The request from customers each time. We mostly using the Chemi is made in Korea, or the Asilo we're using mostly. And the last of the lenses we sometimes import from the other countries, and then, but mostly we using in the made in Korea lenses.
Great, amazing. Also, I really liked the joint parts. You said it made of from stainless steel, right?
Yes.
So sometimes, of course, the guys from Dentoptics said that, for example, if I need to change the angle, right? Like, for example, I'm wearing this glasses and I need to just a little bit move, change the angle, and we can easily change it. They made it when I visited office, and for the first time when I saw my glasses, my loupes, and they changed individually for me. So it's pretty interesting, and I saw it for the first time because you making the frames from different materials, not from only one.
Yes, and it's made in Korea also, and then we have been testing. The reason why we choose about this joint part is stainless steel, we're having a failure about the previous the frames because that you always wearing up like this because you're very exhausted every time, and then so it's quite always in a hurry. You have to move on to another patient here and here, so you're always in a hurry. So we just missed about the point, and then we have testing like with this joint part more than 100,000 times. So it's bearing. We haven't tested more than it just goes on like 150,000 times. It's just moving on and off. Just
amazing.
Yeah.
So I think I guess in Cenosis you have like researchers who make like testing parts and they also crash
we have the engineers
crash tests, etc. So for example, about can you tell us maybe more about the aircraft aluminium, right?
So I don't exactly remember the name of that, but aluminium has lots of materials and then the choices, references. So the reason why we chose about this aircraft aluminium is it should be lightweight.
Yeah.
And then second, it should be sustainable. I mean, withstanding about some kind of some damages. It should be strong. So that's why the reason why we chose about this material as an aluminium. Yeah.
Are you planning to use maybe other materials, not only aluminium or stainless steel, maybe from, that most of the companies who produce surgical telescopes, etc., for example, lightweight or maybe like sport frames or something like that, they use plastic. So what do you think about plastic frames and
the plastic? I'm not very just supporting it because the lines, the axis, optical axis should be very strong. Yeah. If it's flexible, the distance is matching on here.
Yeah, and
if it's moving, the reading is changing all the time. And then your eyes will adapt all the time, and so you don't feel it. But when you're getting old, then your eyes were much tired, and then they will say that, when I wear my loupes, and then I've been having like a 3 or 4 hours having with the patient or with the surgery, I feel lots of dizziness or lots of the eye strains or my eyes are very tired. So that is the reason why they feel tired.
Sure. Yeah. And it's custom made, right? Most of the loupes are custom made. But what do you think about? You have 2.5, right? Dental loupes, like you can change the
flip up.
Flip up version. You can change the length. And what do you think? Is Cenosis planning to produce maybe more magnification, a flip up version, or just you only decided to produce only custom made?
Well, in a way, in the brief, we stick onto the TTL type, custom made one, because that is more good for the customer's health of the eyes. And then the flip up for the higher magnification, it will be making just not good for your eyes. And then if you wear the flip ups, from the eyes to the telescope, there should be in a certain distance, makes eyes feel comfortable. That is what we call in a way the eye relief. It should be in a certain distance. So all of the custom-made loupes are just equipped with a certain eye relief. We calculate with our machines. We invented machines in our factory. So we feel customers will be more comfortable and more better vision with the TTL type, custom-made ones. So that is why we don't produce about the flip-up type for high magnification.
Yeah, sure. Also, I just wanted to ask about I asked about the materials, also about the loupes, TTL, Is Cenosis planning maybe creating a little bit maybe new technologies from now? And do you have maybe information about the new testing, new models, or maybe TTL models, or maybe Ergo Loupes models? Do you have any like startups in this way?
Or to be honest with you, frankly, we are focusing on the Ergo Loupe.
Yeah.
It has been more than 1 year, 1.5 years for the development to making it good for the customer's health. So right now we are focusing on 2.7, and then after that, where we have to consider and we have to research on that. Yeah, we have to think about it.
Great, amazing. Yeah. Also, I just wanted to ask about the statistics because you sell surgical telescopes not only for dentists. You also sell to surgeons, to maybe to cardiac surgeons, to maxillofacial surgeons. And do you know about the statistics? Who buys mostly from you? Maybe in percentage, or maybe just...
So,
from your experience,
in a previous way, our main criteria, our main specialty was in the conventional surgery, like cardiac surgeons or vascular surgeons, or a dentist was a little bit away, but the plastic surgeons and the lasso, in a way, the maxillofacial surgeons are dentists, and the ENT is a little bit mixture. So in a way, the traditional ones was from in the surgical area, but now the dentists are more big buyers right now. So you have to be more, to be honest with you, focusing on the more in the dental areas to be making more sales. And right now, more of the sales are coming up from the dentists, I think so. Yeah. I've been attending this March at the International Dental Show at the Cologne and the Cologne. There's so much people was in there, and there was more than 25 manufacturers of the loupes, like this angle loupe, traditional loupes. They all sell kind of these products, and so that is telling that the dentists are very big buyers right now.
Yeah, and I agree with you because, for example, I graduated last year, and I finished internship this year from dental school, and I would say that about I would mention about the adaptation. I used on the third year of university, I used 2.5, and after 1 year, I decided to move to 3.5, flip up, but after that, after a long time of using 3.5, I realized that I need more. So also, I would say that now currently in dentistry, we have a trend to have dental loupes now. It's a must-have thing because if you want to treat patients in correct way with higher magnification, and if you have higher magnification like 3.5 or 5x, you will be more succeeded in treatment. If you, of course, I'm more focused on prosthodontics like crowns, bridges, and veneers. Also, especially for veneers, we need more magnification. Like maybe surgical telescopes like dental loupes, or maybe microscopes. But I cannot buy microscope, but I decided to use the dental loupes, and for the first time when I saw frames and the dental loupes from Cenosis on the exhibition during the master class, during the course, I really it was the love from the first sight, and after I was thinking I had been thinking maybe 2 or 3 months about buying new loupes, and I decided to buy
it's not an easy decision because the price and then all the things. You have to consider a lot of things.
Price is pretty. I would not say that it's so expensive, but you need to analyze before buying, because if you buy it, you will be using for a long time. It's a long-term order.
Sure.
So I would say that also the price of Cenosis loupes, it's not so huge. It's not so expensive. So it's you produce very affordable dental loupes with very good quality.
I appreciate that.
Also quality. Also, you said about cardiac surgeons, about the maxillofacial surgeons and dentists, and I think why dentists buy more dental loupes, because we need it, and it's a must-have thing now. For example, in the past 10 years, maybe most of the dentists could say dental loupes, it's only for those who are more focused on details and blah blah blah. But now maybe 90% or 80% of the dentists they know it's magnification. It's a must-have thing for
me. I think success. Personally, I think that it's kind of like a trend that if you are using kind of like things like, for example, the cardiac surgeons. Are using some kind of very nice surgical instrument brand, starting with like S. You know what it is then? And then if they're using it and they're accustomed to it, if they're using other brands, they're not satisfied with that. There is very slight difference about that. They can feel it. We just clamp, or if you want to just stick it, you know about the difference about the dental instrument also. If you're using a good ones and then a little bit in the middle class
ones,
you feel the total difference, and then you feel more very competent and then very good with the treatment with the patient. Likewise, that if you're using the loupes, if you're having a trend, if you have the better loupes and this one, you got a nice tools, and then you will be more taking care of the patient more easier way and a more faster way. That means you make more money. And makes you more affordable to buy more loupes. That is for the good instrument and then the good tools for you to making your works and then your life more easier way. So that is the why. If you're accustomed to the Mercedes and you feel it, you never go in a downlight side. So it's like things, our loupes are very in higher level if you feel it. If you agree about it.
And I completely agree with you. And when you see, of course, the people like most of the people who come to the courses for the plates is like this, and they use, for example, they try the microscopes. During the course, they try this loupes, right? During the courses, they just trying during the course, and after that, they understand that they need magnification. There is no discussion about the there is no questions about the level of the dentists who use magnification and about the price, etc. So you said very correctly about the business, about the making money, because of course the main purpose is make more income, right?
But in the same way that if you're using the good tools, you're taking care of, you're saving your patients their teeth and then making a good way. So I see lots of the Instagrams. You're making a photo with your patient, very happy smiles, and then they get recovered from the pain from their like a teeth. The pain is the most painful, like in the back pain and the teeth. Right?
Sure. Of course, first thing that we want to achieve in a practice with our patients in dental office, of course, it's a positive outcome from the patients who wants, for example, who wants the veneers and this bleach 1 or bleach 2, and of course after the consultation, after the visiting of a doctor, and after all the procedures, maybe 4 or 5 visitings, and after that they can see the outcome, they can see the result of the work, and they understand. Of course, patients also, I see the difference because when I got patients without surgical loupes and before and after, they see the difference. And when they see that doctor using and wearing the special magnification for their teeth, for preparing and for treating their teeth, they can understand that they more believe in the doctor, in the result, in the success of surgical or dental procedure, and they are more loyal for the doctor. That's very correct. So I have target auditory on my Instagram and also social media, mostly dental students, and most of them don't have dental loupes. And what is your recommendation for them? I mean, about analyzing which dental loupes is better, like magnification, and from the magnification point and from the financial point. What's your recommendation?
So it's on the same line that it's always better to consult with professionals. Like you have met this kind of people whom we are just working with them, so they know the things, so they can recommend you in a proper way. I think sometimes our distributors provide some financial programs also. I think so. You might discuss with them. So it depends on their needs, but like at the first time I said, for adaptation time, or if you're the first timer, starting with the lower magnification is always recommended. But your professor and then your colleagues are using more kind of 3.5 or 5x, and then it's better to start with the same level. Because if you're having like a 2.5 or 2.8, and then they're using 3.5, they'll be quite more, experienced and leveled. Because they can see more in a precise they can just take away of those things, but you cannot see it. you know the slight difference about the magnification they can provide. So it's always tricky things. So it's always better to consult with your professionals, I recommend.
It's very interesting. Also, you mentioned about the camera, wireless camera. And I don't know, I'm not sure about the price, but it was maybe more than $10,000, right? Or,
a little bit higher range.
Higher. And is it useful for dentists? Because I know those dentists who make presentations, who make courses, they need to show their materials, right? How they prepare the teeth, how they do maybe surgical procedures. And can you explain us from practical part and also from sales part? Is it successful from sales part?
Yes, so exactly pointed out the things who need it, like some professors supported by the university department, and that they can purchase it for the lecturer purposes. So they can have a very nice video program with these actual courses with actual patient. The professors can add about some explanations and detailed things with all the things about the one video. And then like the courses lecturer, they have the lots of the money and then they can affordable and they can use it in a way for their good materials of after the courses. You can also buy the videos, or they can give you the videos for the more follow-up sessions. For you forgot about the things, you go to the toilet or you go to take the phones in the meantime and you miss that part. So you can just review that part with the specific videos, a little bit optimize the video that they can use it, they can add it and provide you. So in a way that they can use it, and then it will be rewarded after a certain time. They can make it. I think so. Of course, after showing, I remember when I visited Vienna, Austria, in January this year, and one of the speaker, Dr. Martin von Sonntag, also used another camera, but it was,
I met a first person in my life, I mean in professional life, who made the videos not from microscope, who mostly make videos from the camera, wireless camera on the dental on the frame on dental loupes. So it's very interesting. It was very interesting, and also from that point, from that moment, I was curious about what technologies they use, and also I found that Cenosis also produce the camera.
It is the thing that you have the cameras like it from in the ceiling room.
Yeah.
But the point of view is different.
Yeah.
It's like a bird eye view, but this point of view is from the dentist. First, you are the one who doing the surgery or treatment. So things like that, what the previous games was in a flat screen, but now they changed it from the point of view from the gamer. It's moving all the time.
From the doctor.
Likewise, you can, if you see the video, you can feel it. Oh, I'm the surgeon right now. I'm doing the surgery.
Yeah.
You're focusing on that more because it's the point of view from the dentist or the surgeon's view. Yeah,
it's very interesting. So, what is the quality, like 4K or Full HD?
It's a Full HD quality, 1920 by 1080.
And what about the you can put the SIM
there is
small
SD card. SD card is also provided, and then 128 gigabyte. It is recorded all the files, MP4 file format inside. So you don't have any tagging on all the things, USB cables. So you're free on movement.
So, and what about battery life?
Battery life, it goes on 4 hours, 30 minutes with Wi-Fi on, LED light on. So it's the same quality of this LTS15 headlight. So it's a very bright. Yeah.
Battery life. So, can you use maybe a couple of batteries just to change?
We provide 2 battery packs, but in a way you can buy in a very much kind of the big size of the supplementary battery packs. It's a very common USB-C. So you connect it with this supplementary battery packs. And then you can purchase some the waist belt. You can put our control unit and battery packs inside, and you can lap it. Things kind of that we can provide, and then you can go on more than 4 hours.
Great, amazing. Everything for doctors.
Because the dentists they can 4 hours 30 minutes. It's okay with me. Enough. But the cardiac surgeons is totally different way.
Of course.
They feel it and they need it.
Definitely. And also, what about the sales of Xenosys loupes worldwide? Like where your loupes is more needed, like worldwide? Can you say about maybe countries? I know that in Kazakhstan Kazakhstan is a new country for
we
Xenosys.
Just started.
And what is the statistics of sales of worldwide?
Most of our sales are coming up from Japan is our number one sales area, and the UK, US, and China. But the European areas is just spreading right now.
But you're planning to also to come.
The Europeans are growing up, but it still takes time. We have been investing lots of time from 2014 or 13. We are attending. It's for the EACTS for cardiac surgeries meeting. We attend every year and also except the COVID,
and also on the dental exhibitions like and Cologne, right?
We just started again, but our distributors are attending lots of exhibitions and congresses in all over the world.
Great, perfect. So we talked. I think we covered everything about the Xenosys loupes, and I think in the finishing part of our podcast, you can tell to our doctors who in Kazakhstan and maybe in Central Asia who will also watch us. You can tell your vision of dentistry and magnification for the finishing part.
I think that you have lots of possibilities ahead. So if you are very satisfied with saving people's life or the saving the customers, the patients' teeth, and then you feel more rewarded from them, you can focus on the dentist career. But in a way, there's some people will think differently. So I don't want them to be a little bit frustrated. So if you're doing on your dentist career and you got the experiences, and you can combine your experience with the other business areas, like our CEO combined his technology to medical devices. Yeah. So you can do it all the time if you have interested in whatever you try to figure it out, what you like and what you're happy about that. So you can focus on combine your dentist career and the businessman. You'll be successful in every field. I think so.
Yeah. And what do you think about the technologies like augmented reality? You know it, right? Augmented reality, virtual reality. What do you think from your point of view? Is Cenosis planning maybe to add technologies, maybe more technologies in the glasses, maybe of augmented reality technologies?
Or in a way, they're like AI and then kind of things that you wearing and then it will be like all automatic. So things kind of like when we are just thinking about the future, the SF movie or something like that. In a way that in someday it's going to become up, but we have to be follow up and then we have to be endeavor our losing possibilities, not to lose possibility about the research.
Step by step.
We will
it takes time, of course. So James, thank you very much for your precious time providing us here in Kazakhstan in Almaty. And I wish you to use every moment to enjoy everything in Almaty. And of course, I'm looking forward to work long term with Cenosis, and best of luck to you. Thank you very much.
Thank you very much. Yeah, very nice. Thank you.
Okay.